Today, we're going to be talking about the exciting world of Mounjaro and semaglutide injections, which have taken the world by storm. As many of you know, I'm an internal medicine doctor, board certified. I also have an integrative background. I don't have any conflicts of interest. No pharmaceutical company has me on their payroll or compounding pharmacy for that matter. So this is coming straight from the heart. I really don't remember a time when we've had a drug class as talked about these GLP drugs. Originally for diabetes, then we saw huge weight loss benefits in many people. As we know, diabetes is a disorder of carbohydrate metabolism, insulin resistant, that is affecting more and more people. A bit of history, the GLP drugs, right when I was finishing residency, the first one came out called liraglutide or Victoza. That was a once a day dosing medicine. It's kind of exciting, but I look at that as like an iPhone 1 or iPhone 2 kind of a product compared to the other things we're talking about, like the semaglutide. In the end, what do these drugs do? Well, they reduce appetite, they make people feel full. There's a cool neurostimulatory aspect of this as the gut brain axis gets a signal and we have satiety. So people are finally getting the weight loss they deserve. As we see, COVID-19 really increased the obesity trends. We have these southern states, which unfortunately are also known as a stroke belt, coming in at red. And I fear that the whole country might be going there. But with these medicines, we have, I think, a chance to hopefully reverse that. So why do we care about obesity? Obesity is one of those things that can not only shorten your life and make you cosmetically unappealing, unfortunately, but it is increasing 13 different cancers. And that is something significant. There's 5 GI cancers like colon, pancreatic, gallbladder, esophageal that are increased, breast cancer is increased. So we really need to tackle that problem. So then we have Wegovy or semaglutide. There's a few names that semaglutide goes by. For weight loss, officially, it's branded Wegovy. Ozempic was approved in 2017 for diabetes, and we had some exciting news as that clinical trial later showed people losing a bunch of weight. So it targets something called GLP-1, which is a glucagon-like peptide, which we have in our bodies. Again, promotes fullness, slowing the rate of gastric emptying. And then last year, we had something called Mounjaro come on the market, which is called a twin incretin. It is hitting 2 things, GIP and GLP-1. So the interesting about that medicine is the GLP strength is a little bit less than the semaglutide. And why is that important? Because sometimes people get a little nauseated from these medicines. That's one of the chief side effects. So it looks like the tirzepatide or Mounjaro could be something having a less bit of side effects in terms of nausea. So fun fact here, if people don't wish to do a pharmaceutical at this point, you can consider doing a little yerba mate tea, and that can increase your GLP endogenously in your body. So that's your cup of tea. Go for it, guys. So what I really like about semaglutide and the importance of weight loss when I have been using these medicines in clinic is really getting patients off of medicines. I have lots of patients that come in with a dozen medicines and they have all the things like heart disease, our stroke risk is high, they're at high risk for certain cancers. And I think every doctor can say just joyful, I think, to be able to downgrade regimens. 2 weeks ago, I had a very nice lady who came to my clinic and I finally was able to, by 50%, decrease some of her medicines. Today, I see a A1C score that dropped by from 14 to 7 after we've been struggling and let's just say not being very compliant. So this gives us a lot of optimism. Sleep apnea, that's also a problem. This can help if we lose weight. So literally all roads can lead to Rome in the situation if you fix the weight and then other things will follow. So of course, I mean, we've been talking about how wonderful this is, but let's talk about maybe who shouldn't be on this. Okay, that's important because not everything fits for everybody. If somebody has a history of a rare type of thyroid cancer, medullary thyroid cancer, this is not the medicine for you. Nor if you have a type of a syndrome called MEN. People with eating disorders, not the best fit. And as well, I know it's summer, we want to look good on the boat and everything, but those that just want to lose little 5 to 10 pounds here and there, not the best fit. Most people I see in clinic are typically females. Age, this isn't something that's really restricted. I don't see kids in clinic, but it is approved now for uh, children. Uh, no upper limit. So if you still would like to be a candidate, I think age is not anything we need to discriminate against. Health conditions, of course, if you have diabetes, hypertension, dyslipidemia, this is a perfect thing for you. I can't say this enough. We have to exercise. We have to get the message to have the proper lifestyle. So you can't just rely on these medicines to get you there. This is a springboard to get you to do the right things. This medicine is really exciting as it changes the relationship to food and especially liquid calories. There are lots of people who also drink a little too much, I think. We know some of those that could be us. This beautifully also has shown to, in my experience, have people drinking less alcohol, wine, and in that end, you lose weight because if you're drinking too many Cokes, too many wines over the weekend, I don't think you will be losing weight. So, along with the usual alcohol strategies, this could be a beautiful aside to do. So, how do we do the semaglutide? Well, it's a once a week injection. We know it regulates insulin production, reduces appetite, and eventually leads to weight loss. So, of course, everything in life is side effects, right? So, what could those side effects be? Typically, we see nausea. There could be some constipation, diarrhea, vomiting. Sometimes people maybe give themselves too high of a dose too early. Typically, I see these things resolving. And the cool part about the compounded formulation we have, it has B6, which if you have been pregnant, perhaps your doctor prescribed to you, super safe vitamin, which can perhaps help you with that. So in the end, what does that destination look like? Well, you're hopefully going to lose at least 15 to 20% of your body weight. Some people lose more. Of course, what you put in is what you get. So if you're hitting this with all intention and you're doing the proper exercise strategy, then I hope you get there. Now, some people, sadly to say, I think cannot tolerate this medicine. It's a small unit, but that's just life. So for that, we have to think about other strategies. So, as you probably know, we have a lot of our celebrities, beautiful people that have been trying this medicine. They are losing weight. My favorite billionaire, Elon Musk, was taking it last year when he unfortunately had some unfavorable photos of himself on that yacht of his. And the TikTok trends escalated, and hopefully the health trends will continue. So this is the future of weight loss. I feel this I mentioned is something that will continue to be um, improved upon. iPhone 12, I say Manjaro might be semaglutide, iPhone 10, 11. There are probably newer and cooler things in the pipeline, and hopefully we'll be having even more success. I've been treating patients for quite a while, and it's really exciting to not have them be on the stimulants. People may have been on the phentermine. I feel that's the band-aid of band-aids. People have high blood pressure after taking it, get very stimulated, and then back to square one. So the $64,000 question: does insurance pay for these medicines? So maybe is the answer. If you have diabetes, then yes, I think you probably will get it covered. But if you don't, if your A1C is not in even the pre-diabetic range, you may have trouble getting it approved. I've had pre-diabetics covered. Now, for people just looking for the benefit of um, the weight loss to fight obesity, I have to say it's really rare. Sometimes somebody has amazing insurance and the stars align and they get it covered and everybody's happy. But usually, I'd say 9 out of 10 times it doesn't happen that way. And we revert to compounding pharmacy. And the compounding pharmacy we use is really brilliant. It's a good place. We trust it. And as mentioned, it has the vitamin B6. Sometimes people aren't happy with that compounding pharmacy option. Well, they can, they go to other countries, but I think this is going to be still your cheapest option by a landslide. Well, summer is upon us, and we're having a special to get you to that destination of good health. I think that's the most important investment one can make, and that, of course, in your family. Imagine yourself 90 days from now. What is your why? I always ask patients, where are you going to be? Why are we even talking about obesity? Because you have probably people that love you, you have people that you want to have more time with. And as we know, time is our most precious commodity. So let's look for that destination and get going. Here at Houston Concierge Medicine, we have a 90-day program where you meet with me via telemedicine. You get to see us in person, you get measured, you get motivated. We refer you for full panel blood work. And every week you'll have an injection of one of the exciting medicines such as semaglutide or Manjaro. So then it's pretty cut and dry. We have this program we've advanced for you. You sign up, you get results, and we're here and we have your back. Again, 90 days is probably the basic time you need to see where you're going. I also have added a biocomposition component to this. It's really important not to just focus on the weight we have, but also the composition of our muscles and fat. In our clinic, we have the gold standard modality of DEXA scan. When you think DEXA scan, some people think of just bone analysis. This looks at your muscle and fat, and we can see in that 3-month period where you've gone. It's super important to look at the muscle component, because if you don't exercise and you just rely on these medicines, you will also lose muscle. And we don't want people to be having what we call sarcopenia or a lack of muscle. That doesn't make me feel good. So as you can see, we have a wonderful program here. On top of that, we're adding B12 shots to get more energy going, with also some amino acids, methionine, inositol, and choline. These will help detoxify you, get things moving in the right direction. And I will be surprised if majority of patients do not get that 50% decrease in body weight, and just grateful to be living better. So as mentioned, those B12 shots, this could be good for you. We will give you an injection in clinic. You are able to do that at home. They are very easy, no problems at all. The injections for the semaglutide or the Manjaro, very, very small needles, very painless. So as well, we'll coach you through that whole session. And of course, guys, I'm open for questions at any time.
Dr. Burzynski, I have a question that says, do you recommend this for someone that has had weight loss surgery?
Exactly. This could be an option for people that have had weight loss surgery. It's not a contraindication. And of course, we take it case by case, and hopefully people tolerate well. Thing I didn't mention is everybody has a different dose for this medicine. Some people are at the lowest rung of this medicine and do beautifully, and some people need a little bit more help. Meaning we titrate you up to the higher levels.
Okay, great. And Dr. Burzynski, what happens after the 12-week maintenance? Like once they complete the 12 weeks, where do we go from there? That's what they're asking.
Very good question. We usually continue going. At that point, we see, have we reached our destination? Have we gotten to where we want to be? Most of the time, I think it's a very good beginning. And then we carve out the plan of, do we downgrade the regimen? Do we use less? Do we continue still for the next few months? More than likely, majority of patients will be continuing on some level, and then we have a discussion at some point. I think I'm ready to taper off, to downgrade this.
Okay, great. Another question, is the injection safe for people who have Hep C?
Yes, it's safe.
Okay, great. Another question, what is the meal plan like on this injection?
Right. Well, nutrition is exquisitely complex. You have people that are advocating for plant-based versus ketogenic versus other plans. I would like a anti-inflammatory dietary pattern. I think that covers a lot of bases. For personal reasons, some people prefer to go vegan, or they have food allergies or sensitivities. So that has to be taken into context. We discuss nutrition in regards to that. And typically, people will lose weight either way, unless, of course, they're still eating the Krispy Kreme donuts, right? But that, of course, I think that message gets changed in the brain. So good nutrition follows.
Okay. And also, is this injection cause any rapid heart rates?
It should not. That's the nice thing about this class of medicines. The prior medicines we've seen were some of them taken off the market actually. They were amphetamine based. They caused people to have arrhythmias, high blood pressure. And that was frustrating, especially for doctors, because we had to then treat those problems.
And could you explain the B12 shot again and how that's incorporated in this package?
Of course. So patients receive a B12 shot as part of the program, which is once a week given as an injection. The patient usually injects it themselves. We're more than happy to do that for the patient if they are needing that help. And we can continue that as well throughout after the 12 months. So it's a once a week injection of the vitamin B12, methionine, inositol, and choline. I think there's a question about me being in Texas. So you need to be a Texas resident this time to take advantage of this program. I think we're living in exciting times, and it's really important for people to take advantage of this, as finally I think people can reach their goals, their destination of good health, even though they've struggled, they've been on diets, they've maybe failed. I think now I've seen so many hopeful stories that I encourage people not to give up and to go for it.
Okay, awesome. Thank you so much, everybody, for coming. We will also, just so you'll know, we will be posting this on all of Dr. Burzynski's social media, as well as on his website in the next 24 hours. So you will be able to watch this and or share with any of your friends and family. And the special will be good for the next 24 hours. And again, as always, if you have any questions, you can call his office and they will be happy to help you. In the meantime, we thank you so much for coming. Dr. Burzynski, thank you so much for presenting this awesome topic that's been super trending and super hot. And we will see you guys next time. We're going to have another webinar very soon. Stay tuned. We appreciate you checking the text and or email if you got them, but we're going to be doing this on a regular basis. So stay tuned.
Thank you so much, Andrea.
Thank you, everybody.